ARDS kills people, and there are different types of ARDS in terms of the mild, moderate, severe. This is the PF ratio calculation. If the PF ratio is more than 300, that's excellent. Less than 100 is very bad, and the mortality goes up as your ARDS gets worse. And these are approximate numbers where you know that the higher the numbers, the worse it is. In COVID-19, we are seeing a lot of patients not make it, mainly because they're ending up in very severe ARDS. There's been a lot of WhatsApp forwards on the theory behind how COVID is not ARDS, etc. But so far, in my experience and knowledge of taking care of these patients, as well as talking to doctors who are taking care, the standard ARDS pathology and physiology is working. There may be some exceptional cases where we need to use a different technique. So PaO2, which we talked about, is the dissolved oxygen in plasma, that is 80 to 100 millimeters of mercury. And saturation, SaO2, is a percentage of available oxygen bound to the hemoglobin with a normal range of 95 to 100%. Almost 98% of oxygen is there for tissue delivery, which is bound to hemoglobin. A little bit is dissolved. And SpO2 is a non-invasive measure of your saturation, which is SaO2, arterial oxygen. We talked about the SpO2 and oxygen relationship. So this is this relationship. On the y-axis, the vertical axis, you have oxyhemoglobin saturation. On the x-axis, you have the PO2 from an ABG. So you have the saturation versus the PO2. You can see that the curve is sigmoid shaped or S-shaped. If you go back to your physiology, I don't know which book you guys use, like Guyton, Ganong, I'm not sure which one you guys use nowadays, but try to pull it out, avoid the dust. I'm sure it's covered under dust, all those books. So dust it off and look at the page on oxygen dissociation curve. You're going to see that this is a curve that is S-shaped because the patient has 4 hemoglobin globin molecules which are there around each ion element. Once oxygen connects, the affinity of the molecule to oxygen increases. This is the phenomenon of cooperativity. So as you go up, as you start connecting oxygen, your affinity for oxygen keeps increasing, but up to a limit. So once your saturation hits about 90%, your saturation and your PO2 don't correlate anymore. In other words, a saturation of 90% could have a PO2 of 60. A saturation of 95 could have a PO2 of 150. A saturation of 98 could have a PO2 of 300. Going in the backward direction, a saturation of 50% might have a PO2 of 30. Likewise, if you look at the oxygen levels and the saturation, there are many factors that affect it. For example, if you have a temperature increase like a fever, your curve shifts to the right. If your acidosis, pH being low, your curve shifts to the right. And the reason for that is very simple. Evolutionarily, this has allowed us to release the oxygen more easily. So at a higher temperature, for the same saturation, you have a higher PO2, which means your body is allowing your oxygen to be released. So in a case of septic shock, sepsis, fever, infection, it makes it much easier for you to actually have the oxygen released. So if your shift is to the right, or more oxygen is available, the plateau phase, which is this middle part, is where you're having a, let's show you something here. So this middle section here, all of this part. So these are the sections where you're having a plateau phase where the relationship is a little different. This is where the blood is going in the capillaries and they're carrying oxygen. Let me show that again to you here. So if you look at actually, this is the plateau, the top, sorry. Let me pull this up 1 second here. So I'll point an arrow here. Yeah, this is the plateau phase. So this plateau phase is where your capillaries, the oxygen is increasing. And what I showed you elsewhere, so this stuff here, these are the places where you're having the steep rise. And the steep rise is happening because your capillaries are releasing oxygen in the systemic capillaries. So pulmonary capillaries carry oxygen and the systemic capillaries are releasing oxygen. And we talked about the concept of cooperativity.